Okay, and now we are on to part 3. Vygotsky's sociocultural theory. Vygotsky, in a nutshell, his theory is that children learn by imitating or modeling after older peers or adults. So in this chapter with infants and toddlerhood, he is saying that complex mental activities will occur or develop through joint activities with more mature members of child's surrounding environment, people. So he had the zone of proximal development, where tasks are too difficult for a child to do alone, but the task is possible with the help of more skilled partners. So for example, when they're first learning how to build a tower with blocks, the child would not know how to do this or be able to do this until it is demonstrated to them, and perhaps the first few times an adult helps them with how to stack a block on top of another block carefully so they don't fall over. So this is the zone of proximal development. So infant and toddler intelligence tests. Just have a little understanding of what these are. There's the Bailey scales, which assess cognitive, language, motor, social, emotional, and adaptive behavior. They do predict later intelligence very poorly, so they're not good for predicting school-age child or adult intelligence, but they are mostly used for screening. Screening for preschool readiness or kindergarten readiness. Another kind of intelligent test that you, I'm sure, have heard of is the intelligence quotient, or the IQ. And this is a comparison with typical performance for age. It is standardized. There should be a normal distribution, meaning the bell-shaped curve. And it is used for infant tests and later performance. It's also used as a screening test. When I say a normal distribution for IQ scores, this is a picture of a normal distribution. You'll see the score of 100 is the mean, meaning that the majority of people who are screened have average intelligence of 100. To be below average would be to have an IQ of 85 or 70. To be above average would be to have an IQ of 115 or 130. Another measurement is the home observation for measurement of the environment. And so this is looking at features of a high quality home life. You have parental emotional and verbal responsiveness, parental acceptance of child, organization of physical environment, their provision of appropriate play materials, parental involvement with the child, and opportunities for variety in daily simulation. So what does this mean? A lot of testing and studying of educational motivation for school-age children and adults, it goes back to looking at what was the home environment, home life like for these children. In many of these studies look at what was the educational level of the parents. How many books does the home have? How many hours of television do they watch versus how many hours of reading or gameplay? And then they look to see how these impact the child's educational motivation or their self-efficacy. So features of a high-quality home life, it is a big measurement, and it is also used as part of screening for entry into preschool or kindergarten. So developmentally appropriate infant and toddler child care. As your infant has progressed into toddlerhood, it is essential to start looking at child care, moving into preschool, and where these children are placed does become important in how they do for the remainder of their school age years. So looking at what many of you have posted for your 3-month-old child, and a few of you brought up childcare arrangements, and you were comfortable leaving them with a family member, or you were changing your work schedule to stay home for the first year. I want you to look at, when you make your post next week about your 2-year-old, I want you to put some consideration into what kind of childcare will you have for your infant and toddler. Look at the physical setting, what kind of toys and equipment are provided, the caregiver to child ratio, what are their daily activities, how much interaction do they have among adults, what are the qualifications of the caregiver, and the relationship with the parents, and are they licensed or accredited. When my children were growing up, I had 2 different types of childcare that we utilized, so actually 3. Our first childcare provider was basically, I knew that I was leaving my children in a safe environment. She watched them, she fed them, she met their physical needs. They played with toys, and they watched television. So typically when I left them in the morning, I plopped them down in the middle of the family room. When I picked them up in the evening, they were still sitting in the middle of the family room, clean, fed. Then we moved them to another child care, and it was an in-home babysitter. But in this instance, she had a regular routine. The children had planned activities for the day. They did coloring, they did learning, they had an enforced nap time, they had chores, and the children thrived in that environment. They came home with new skills. It was a great environment. So and you want to look at that, weigh that, and see how that impacts your child's development. So this slide, in your textbook, it talks about there was a study that was done in the Carolinas, and they look at IQ scores of controlled children and children who were in a treatment program. And this was an intervention, in other words, providing that high quality child care environment and looking at the improvement in the scores. So, moving on to theories of language development. We had 2 types. We have the nativist, or Chomsky is the theorist, language acquisition device that contains a universal grammar, infants biologically prepared to learn language. That is his theory, that we come pre-programmed how to adapt to that language. And then there's an interactionist theory, meaning that through interaction between inner capacities and the environmental influences, our language will develop. So, not saying that either one is right or wrong, both of them can apply to how our language develops. So getting ready to talk. When baby first starts to talk, we have cooing, and babbling. I still remember my son, my one that just left for college today, when he was 6 weeks old, walked into his room, and he was in the crib, and he looked at me and he smiled and he said, "Gah," with a G. It was his first babbling sound. I still embarrass him with it, but those were his first speech sounds, when he realized that he could make a purposeful noise. And then that whole day, because he got a reaction from me, it was ga, 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 ga. So let's go back. Several slides back, he was doing imitation in the very early stages. So as baby's getting ready to talk, they become a communicator. They learn to focus. They make purposeful noises. They'll do give and take, where they'll make a noise, you make a noise. and they'll do pre-verbal gestures. So this is the toddler who points at the fridge, but they don't use the words. So pre-verbal gestures. So then as they begin to talk, they start with underextension, which is where they use minimal language. It may not be sufficient to really make a point, but this is where they also use the gestures to help convey that point. And then overextension is where they're using too many words to make a request. They'll have two-word utterances, me want. And then they'll begin to copy adult word pairings. So this is where you'll have the little toddler who then says this adult phrase that makes, is out of the blue and can be quite entertaining. So those are two-word utterances. You do want to have an idea of what an underextension and an overextension is. These are in your book. Review the definitions. So what are individual and cultural differences on language development? It can be dependent on gender, what their temperament is, and then again what their environment is. If they have a lot of verbal stimulation, if they have somebody who's talking with them, they will develop and utilize verbal language quicker than the child who lives in a quiet home or doesn't have somebody interacting with them verbally. Then they're going to be slower. And then what are the characteristics of the native language? So how do we support early language learning? With an infant, we want to respond to coups and battles. We want to establish joint attention. We want to use infant-directed speech and play social games. With toddlers, we want to it is fun, but we want to engage in joint make-believe. Engage in frequent conversations. Read books to them and talk about books. Both age groups will develop quickly in language when they have these features, and you want to kind of be aware of these, and you're going to utilize them as you progress into nursing. If you move into pediatric nursing, how you interact with those children. And that is it for Chapter 5. Thank you for taking the time to listen to this. I hope it helps to clarify what you're reading in the book. And have a good weekend. Bye.